So another way that insurance companies try to kind of cut back on cost a little bit is through what's called managed care. And managed care is basically where the insurance company puts some sort of limitations on what or who you can say, what you can get done or who you can say. So some examples, some managed care techniques that are used. It's when an insurance company has, for example, a selected set of providers, also known as a network. There's also standards on selecting providers. So, for example, you can't just go see a back specialist if you're back first. You have to go to your primary care first and then get that person to refer you. Others have emphasis on preventative care. Some have benefits when you do that. But these are just some examples of managed care techniques that are put into place. The provisions, basically what happens is with managed care, insurance companies have provisions written in of what you can and can't do. So, for example, some require you to have a primary care physician that kind of controls everything. Everything has to go through him. That's also called gatekeeping. And with gatekeeping, not to be confused with the gatekeeper in Ghostbusters, which you may not have even seen, but gatekeeping is when all referrals must go through your primary care physician. You want to see a specialist, you have to go through your primary care physician. All right, this is big with HMOs. Capitation is another form of restriction. And these are really all just different types of provisions that are in place to really stop you from just going to do whatever you want. Now, when it comes to managed care contracts, all right, there's no such thing as a managed care plan, managed care is how an insurance plan is structured. And so there's a couple different classes of these. So high deductible plan we talked about, but these other ones, POS, which doesn't stand for piece of, it stands for point of service, PPO, preferred provider organization, and HMO, health maintenance organization. Now, there's a video that actually shows this a little better than I am, so I'm going to pull that up now, and this over here.
The insurance industry is full of acronyms, as we all know. Today we want to spend a few moments and talk to you about the different products and plan designs that are available to you in the group insurance marketplace. We're going to discuss HMOs, health maintenance organizations, point of service plans, commonly referred to as POS options, and the largest in the marketplace, PPOs, or preferred provider organizations. Today let's talk about the first of the three models that we're going to discuss, health maintenance organizations, commonly referred to as HMOs. HMOs are the least flexible of all the plan designs available in the marketplace today. Very restrictive from the standpoint that it is an in-network only driven product, which means you must pick a primary care physician. Oftentimes these are referred to as referral-based plans, where you've got to pick that doctor. These particular plan designs are copay driven as opposed to deductible driven plan designs. What that means is when you access care, you'll be receiving out-of-pocket copays that work toward an out-of-pocket maximum. Once that out-of-pocket maximum is reached, then your coverage is all at 100% as long as you stay in network. Most of the features that are found in these plan designs revolve around a variety of drug cards and a variety of different office visit copay amounts that you can select. The second model we're going to talk about today are point of service plans, commonly referred to in the marketplace as POS plan designs. These plan designs are more flexible than the HMO model we talked about previously. They do give you an in and an out of network benefit feature as a result. They are still referral based inside the network, means you still have to pick a primary care physician and have your out of network care referred. These particular plan designs, similar to an HMO, are also copay driven to the out of pocket maximum. They typically carry similar features as the HMOs, including drug cards that you can choose from and several different office visit copays. The beauty of a point of service plan for those that are a little nervous about keeping an HMO with an in-network only benefit is that they do carry an additional out-of-network option at your choice that is a deductible-based, non-referral environment that you can choose the care, receive care. When you hit your out-of-pocket maximum, your care is then covered at 100%. So it's basically an HMO product with a swing out, as we would call it in the marketplace, indemnity feature for you if you want to choose. Finally, let's talk about PPO, or Preferred Provider Organization plan designs. These particular plan designs have been around since the late 1970s. They're the most popular and most flexible in the marketplace. Why are they the most flexible? These particular plan designs give you in and out of network benefits that are typically much richer at much higher levels of coinsurance than HMOs and point of service particular plan designs. These are not referral-based plan designs. These are what we call open access, meaning you can pick and choose your care and your doctor at your own will without having to have a referral. These particular plan designs are deductible driven as opposed to copay driven. When you access care, you'll have a deductible, then you'll have a coinsurance to an out-of-pocket maximum. The features are similar to the other two plan designs we talked about. Drug cards and office visit copays are both available on these plan designs with a lot of different options and choices. The real key to the PPO marketplace is these particular plans, as we mentioned, carry an out-of-network benefit that has a much higher, richer level of coverage than the aforementioned point of service and HMO plans. This is Jim Sexton.
Okay, so those are some examples of managed care plans. And so just giving you an idea of what a PPO, so with the PPO, the Preferred Provider Organization, you have a network of doctors to go to. Now, a lot of times you can go to doctors outside, but you have to pay extra for that. And so if we look here, here's one example. Now, if you go within the network, they will pay 100% of the hospital, 90 physician, 90 therapists, no copay for drugs. Whereas outside, they're going to pay less. So the reason why they do this with the PPOs is they do negotiation basically. And so they go to these doctors and they say, look, you can be in our network, and we'll send patients to you. They would say, that's great. Why wouldn't any doctor say yes to that? Well, the reason why is that in return for that, they have to agree to charge less to them. So we'll send you our patients, but if we send them to you, you're going to give us a little bit of a discount for it. So this is a way for them to kind of control costs. Now, with the types of managed care plans, where there's very little is what's called an indemnity fee for service, FFS. And these are plans that really you can get what you've done. There's very, very little controls on it. You know, you want to go see a doctor, you can go see the doctor. You want to see a specialist, see the specialist. You want to get this medication, get this medication. Okay. And then there's very little limitations on it. On the other hand, PPO, Preferred Provider Organization, there's some limitations. What happens as you move from left to right here, it's tighter management controls, there's more restrictions. And so, for example, with a closed HMO, which is you have to go to HMO doctors, right? It's very, very restrictive, and it's very difficult to see specialists or go see someone else if you need to see it. Whereas an open HMOs are similar, but there's a little more flexibility. You can see HMO and non-HMO doctors. So, managed care. What is the distinctive feature? The distinctive feature of managed care plan is that there is a manager. So what you have is, no, it may not be a person, it may be a group, but a manager is someone who intervenes and they manage relationships. So the manager manages relationships in a managed care plan. Say that 3 times fast. So if we look here, so this is typically there's really two groups, and try this again. There we are. So if we look down here in this bottom figure, let's see what it is. There we are. So there's the three-party transaction, which we talked about. The patients go to the providers, they get services, they give some money. Patients pay the insurance company their premiums, and the insurance companies pay the providers via reimbursement. Excuse me. So the manager manages two relationships. The first relationship that the manager manages is between the insurance company and the providers. Okay. So the manager steps in and says, they tell the providers, look, they negotiate prices, they negotiate rules and regulations. Tell the doctors, say, look, you want to do this, fine, but this, I don't know. Okay, so there's certain procedures that are done or put into place, but a lot of the intervening that the manager does at this point is negotiating prices. So they step in and say, look, let's talk about the prices. We want to bring it down. Okay. So that's the first. That's the first relationship the manager manages. The second relationship is between the patients and the providers. Okay. Now, this is where they tell the providers what services they can and cannot perform, if they want to do something. For example, if they want to do a surgery, the patient, they need prior authorization, or they won't allow them to do it. Now, this is also where they tell the patients where they can go, how they can do it, in-network versus out, referrals, and all that. Okay? So those are the two relationships that the manager manages. So what is the goal of managed care, and what's the goal of the manager? To reduce costs. They want to bring their costs down so that they can be competitive with other insurance companies. So when it comes down to it, there's three ways to reduce costs. So you want to reduce costs, which lead to lower premiums. You can so if this is how much in premiums they need to charge, they need to collect their overhead, which is what they pay their employees plus profits. Plus, they need to pay out for the care. Now, what they pay out is the price that is charged times the number of services that are received. So there's three broad ways that they try to cut costs. One is by reducing prices. So you reduce price, premiums go down. They do this through negotiation. The second way is through quantity. They reduce the number of services, total premiums can go down. This is by the limitations about network and referral basis and review, prior authorization, all that. The third way is overhead. Now this is a little bit outside the manager's scope, but they can try to get the organization to restructure or work on economies of scale to try to just be a little more efficient. And so this just kind of sums it up. They reduce it by reducing prices or quantities. They can also work on substituting cheaper inputs. For example, they can say, we'll talk about this more pharmaceuticals, but if you need a medication, a lot of times you can either get the brand name or the generic. The generic isn't quite as effective, but it's cheaper. So a lot of times they can require that. And then reorganization is the other way. But in any event, with the managed care plans, overall, they want to reduce those prices. They want to bring the premiums down.